Cases were there, lot of confusions were there. So ultimately, it happened. The exam is over, and I am very well aware, and I can understand the situation what you are in. So many of you would be very happy with your presentation, and some of you would be averagely okay, and some of you, very few of you, may not be that happy. So there will be a mixed reaction among the student community. But my dear friends, finally, please understand that the exams are over. So today we will have an overall analysis of the NEET MDS 2024, the question paper. So definitely, see, before starting the preparation, just 1 year before, where were you? Lot of confusions, what to do, how to study, how to cover 19 subjects, which subject to study first, which to study later, revisions, mock test, so many things you have gone through. And after that, the final day arrived and you went to the exam. And a lot of new things were there in this exam, but most probably the same thing was there. The pattern was almost the same. So please understand that it's been almost 2 days after the exam. So definitely after your exam, you would have hibernated, you would have slept a lot, and now you would have woken. So we thought in Edentu, this is the correct time to speak to you all. So today we'll do an analysis. The main motto behind the analysis is just to be aware how was your performance. Detailed subject-wise teachers will do the analysis little later. So today will be an overall analysis. But please understand that you have studied one complete year. So this is the time where you have to relax, enjoy, and be very cool and be very optimistic. There is no point doing a post-mortem of the question paper. But you should be aware what went wrong, what went correct, how did you do in your exam. Because after all, you have studied 1 year and you performed in 3 hours. You should know where you stand. But at the same time, do not do post-mortem and discourage yourself. Definitely, there will be few questions which you knew the answer, one or two you may go wrong. Way back when I wrote my examination, there were some 7 to 8 questions which I knew the answer, but I made it wrong in my examination. And 7 to 8 marks would have brought a drastic change. But still, it could manage to give a very, very good C. Same way, there will be few questions which you would have thought an answer and marking would have gone wrong. So don't, that is a human error which is done by every one of us. Okay, so let's go to the paper analysis. So first and foremost, overall difficulty index of the paper. Before that, the paper had 240 questions. Part A was 100 questions, that is the basic science, and the remaining 140 questions were from the clinical science, where image-based questions were there. And Almost some 70 to 80 marks questions were direct straightforward questions which anyone could answer. So 70 to 80 marks were straightforward questions. And then there were clinical based questions. Almost this clinical based question, most of the questions were from pharmacology, meaning the drug of choice. They would have given a condition and they want to know what is the drug of choice. So more of pharmacology based questions were there more this time. Apart from that, few difficult subjects, general medicine, prosto, general surgery. So this general medicine actually every year it is little tough for the dental students. So this is nothing different from the previous examination. Prosto, yes, questions were little more, applicative questions were more, but if you would have done a detailed study, you could have been successful in answering those questions also. Okay, so now let us know what was peculiarity in this question paper. First and foremost, see, this question paper had 240 questions. In that, 4 marks for every correct answer. -1 for negative. If you answer and your question goes wrong, answer goes wrong, -1. And any question which you have reviewed, you kept a star mark or reviewed. So reviewed questions were also evaluated this time. So will be evaluated. So what will happen? You have kept it for review. That means you are not very sure about it. But the computer will pick the answer and then according to it, if the answer is correctly marked, you will be awarded 4 marks. And if you have not marked correctly, -1 would have been there. So even the doubtful questions, the review questions are also evaluated. So this is what one thing you should be knowing about this. And there was something very new this time, like for example, calculators were there, digital virtual calculators. So two to three questions were there where this virtual calculators were given. So basically, no pens were allowed. All thing what you have to do is your admit card backside you have to do all your rough work. That is basically it was more of a mental calculations and mental things this time. So no pens are allowed and the digital calculators. So one question was from PhD and another question was from general medicine, I guess, where blood pressures were given. You need to calculate that. And then there were image based questions, which was from almost every subject. That is expected. Image based question, almost expected. Whereas from oral surgery, the questions were very easy. So as I am an oral surgeon, I'll be discussing few questions of oral surgery. And then our team of all teachers, subject faculties, in few days will come and they will do a detailed analysis of all the 19 subjects. Right. So coming to some of the oral surgery questions. Right. First and foremost, the first question was very simple, straightforward question, which even in third BDS, if you open a book, you will note this. So the Leaford fractures. So Leaford 1, 2, 3, which is this fracture? So this is actually a straightforward photograph taken from Google also. Google images, the first photo comes like this only. So this is basically Leaford 2 fracture. So it's very straightforward. Leaford 1 is the low level fracture. Leaford 2 is the mid phase and Leaford 3 is the suprazygomatic fracture. Leaford 2 is also known as floating or pyramidal fracture. So this is the basic. It's a straightforward question without seeing within seconds you could answer. So basically, I will sum up this all 240 questions in such a way around 40 to 50% were easy questions. 40 to 50% were easy questions. Then 30 to 35% were moderate questions. And then 10 to 15, the last 10 to 15 are the difficult questions. So these difficult questions are always very tricky questions where even the topmost rank in India also fails to answer that. So that is just to filter out the students. So if you are very perfect with your easy questions and moderate questions, definitely 70 to 80% you can score very easily. So the paper was easy, moderate or tough, it's a relative thing. What is easy for me may not be easy for you. What is easy for you may not be easy for me. So please do not compare with anyone. all you need is just one rank, right? So one seat you need to get into MDS. So this is the first question, direct question from your Leaford fractures. So Leaford 1, 2, 3, which we know that. Detailed analysis will be done later. Next question, very simple question when it comes to oral surgery, right? Even in your basic BDS exams, we will be going through this. Calculate the Peterson's difficulty index. So Peterson's difficulty index, you can see here, this is the tooth. So third molar, you need to know the Peterson difficulty index. So here, Peterson difficulty index, 3 parameters are taken, which we all know that, right? So first one is position of the molar. If it is mesioangular, value is 1, right? So in our case, you see that this tooth is mesioangular. So the position of the tooth, score of 1 is given on being mesioangular. Then the second parameter is relative depth of the tooth. So depth of the tooth, whether it is class A, class B or class C. So class A is at the level of second molar, B is in between the occlusion plane and the cervical level of the second molar, third molar is between the occlusal plane and the cervical level of the second molar, and position C or class C is completely down. So here it comes in the class B position. So class B and mesioangular it is. And then we have got what is the relationship with the ramus of the mandible. So you can see that there is actually no space available over there. So it comes under the most, what you say, the class 3. So it is 3. So 1 plus 2 plus 3. So the score will be 6 over here. So 6 means it is moderately difficult case. So easy is 3 to 4, moderate is 5 to 6, and difficult is 7 to 10. So our answer is 6. So that was the option here. So answer will be B over here. So that is all about Peterson's difficulty index. Next question was, which of the following is true about cleft lip? So we have got 4 options and 1 is wrong answer. Which of this is true? That means 1 is correct answer and beg your pardon, 1 is correct answer and 3 are wrong answer. Okay. So most often associated with congenital syndrome or systemic deformity. It is not like that. It's a developmental anomaly also, right? So more common in females. So you can see this. It's a very clear cut. Those students who are studied with Edentu, it's directly taken up from the question banks. So these are some high yielding facts related to cleft lip. So it is 1:800 is the incidence in the live birth. Cleft lip are more common in cleft lip are frequently common in males. So there the option was given females, right? And then isolated cleft palate are more frequent in females. Then your left hand side, right hand side, which side it is more common? So cleft lips are more common on the left hand side rather than the right hand side. So you can see that cleft lip is more common on the left side than the right side. So this is the correct answer, which is there. We have just discussed that. So this is the correct answer. So like this, questions are there this time. So direct questions. It is just little bit of thinking. Direct questions. Next question from local anesthesia. How much epinephrine can be administered to a patient with angina pectoris? So it is basically a cardiac patient is having chest pain and all. So we should give the most minimum amount of local anesthesia, that is the adrenaline we have to give. So this is some of the values I'm giving you. So 1.0 milligram per ml is for anaphylactic patients. If any allergy has happened, it's a life-saving drug, you can give that. Then in cardiac arrest, 0.1 mg per ml. So then our cardiac patients, 0.1 mg is the answer. So here 0.04 is also the cardiac patients who are having a lot of congenital problems and difficulty. It is the answer for that. It's actually basically a straightforward question which is there in all your MCQ books, right? Next question. All of this is true about arthrocentrosis of the TMJ joint except. Basically, all the four options looks almost correct here. So the first option, anatomical landmarks are laid on canthal triangle line, which is also called as HH line. HH line is the correct answer. That is Holmlund and Helsing line. So that is what is shown in your screen also. Ringer lactate 250 to 300 ml solution. Generally 50 to 500 they say. Upper compartment you will flush it out, and from the lower compartment, low grade suction, you will take it out. Inferior joint space lavage, which pushes disc away. This can be the most, what you say, except one, wrong one, but it is also in a way it is okay only, because whenever the disc displacement is there, it is anteriorly displaced. It's not away. It is known to reduce joint pain and inflammation. That is also correct. So compared to all the four options, the third option will maybe most probably accept. Next question. Identify the instrument shown in the image below. So a lot of questions were there for MCQ, like image based questions, almost from every subject it was there. So oral surgery, very simple question. This question, which is used for cutting the bone. So this is nothing but giggly saw. Giggly saw. So what is giggly saw? It is a wire used by surgeons for cutting the bone. Normal cutting the bone. So basically, when diabetic foot is there or you want to go for amputations, here you will be using giggly saw, where smoothly the bone will be, layer by layer it will be cut and it will be amputated. So that is giggly saw. This photograph, this was shown in the exam. Next question. A full term child is born. Full term means all 9 months, all the 3 trimesters took place and the child was born with unilateral cleft lip. The parents are very anxious and want to know about the reason for this deformity. So there is unilateral cleft lip. One side cleft lip is there. The embryonic basis for the defect is failure to fusion between these two processes. So this is a very, very basic question from our embryology, which in first BDS people study, right? So basically, it's directly taken from the MCQ books also, you can call it. So how the cleft lip happens? The maxillary process fuses with the lateral nasal process. Lateral nasal process will fuse with the medial nasal process. Medial nasal process will fuse with the frontonasal process. But what is the most appropriate? So here it will be medial nasal process fuses with the maxillary process. So in the high yielding facts, you can see that cleft lip occurs due to defect of fusion in the medial nasal process with the maxillary process. So normally this should fuse, but if it is not fusing properly, then the cleft appears. So this is a straightforward question, which is almost 95% people can answer this. Next question. What is the meaning of marginal resection? So it is again, you would have studied this in cyst and tumors chapter, where complete resection, marginal resection is there. It's resection without the discontinuity of mandible. So you can see here, the lower border of the mandible is left intact. Lower border of the mandible is left intact. So resection without discontinuity of mandible is the answer for this. Then again, one more question was asked. This is little difficulty, little more you can call it. Which of the surgical orthodontic procedure is least stable? That means you do a surgery and it is not stable, right? So the answer is maxillary widening. So maxillary superior positioning, mandibular advancement, your BSSO setback. So this advancement setback are comparatively more stable, but this maxillary widening is not. So the two procedures in orthognathic surgeries which are least stable, one is maxillary expansion with semi-rigid internal fixation, and the second one is clockwise rotation of the mandible with rigid internal fixation. So these two procedures are least stable. Okay, so this was also a question of oral surgery. The next question was A 23-year-old boy had road traffic accident and sustained a fracture angle of the mandible. So angle of the mandible fracture happened. Which of them is the best treatment option for him? Sorry. So whenever you are doing a plating, always the sham face osteosynthesis line of osteosynthesis has to be taken care of. Sham face osteosynthesis line has to be maintained. So in that line only you will be doing the plating. So as in the diagram you can see it very clearly, angle fracture. So there is two lines are going. This area if you can focus, right? Two areas are going. Two lines, sham face lines are going. So answer most appropriate to satisfy the sham face osteosynthesis line. Two mini plates, one at the superior border, one at the inferior border can be there. So if it is symphysis fracture, two plates are there. Parasymphysis, one. Okay, so something. Next question, systemic toxicity of local anesthesia is described as. So whenever toxicity happens, always there is an excitation followed by depression. So this is actually a universal law of nature. There is excitation followed by depression. So convulsions will be there, the patient will become hyperactive, and then after some time there will be depression. So this D is the correct option for this. So this is the explanation at moderate dose, high dose, what happens. This you all have studied. Then next question, basically this is from anatomy you can call it. Which of the sinuses does not drain into middle meatus? So we have got superior meatus, middle meatus and inferior meatus. So which of the following does not drain into middle meatus? So in the middle meatus, what all drains? We have got middle ethmoidal air sinus, frontal sinus, anterior ethmoidal air sinus, maxillary sinus. So these are the ones which open or drain into middle meatus. So seeing the options, anterior A drains, B option middle ethmoidal sinus, yes, maxillary sinus also yes. The only one, posterior ethmoidal sinus, it drains or it opens into the superior meatus, not in the middle meatus. So this is the question from your anatomy. So these are the way the questions were asked. And then some other questions which were asked in the exams. I again repeat, our specialist faculties will come, expert faculties will come, and they will explain all the questions. They will decide, go into the depth and discuss everything in detail. So some of the questions, this is all recall based, just on recall because there is no available question paper outside. It's all students from different parts of India. Our students have recalled and given us these questions. So these are some of the questions which were there in your exam. This subject faculties will discuss. So I'm just giving you an outlook what was there actually. So winter bottom sign of trypanosomiasis refers to. This was the question. And then this question we have just discussed. Sinus opening not into the middle meatus. Age estimation of an OPG. So one OPG was given and tell the age estimation. So third molar is the one where mixed dentition is the one, all those things were given. Thick band in the gingiva on canine. What is this called as? Interproximal wear was the mesial drift. That was one question. Macule Albright syndrome, common features were asked. So like this, so many questions were there. Tumor staging, classification grading system was asked. And then organisms involved in straight away direct question. Border movements and neutral zone while recording muscles. Mean and standard deviation value from your public health dentistry. This question was there. Standard error, precancerous lesions, and the best treatment for avulsion if it happened just in 10 minutes. How the child can save the tooth and the doctor eventually will save the tooth. That was the question. Unilateral cleft lip, which we have just discussed right now with the options. So this was also a question over there. Apart from that, anterior teeth and periodontically it is compromised. So what is the major connector given? So it is basically a case-based scenario questions was there. Merin's classification, dose of adrenaline, angina pectoris, which we have just discussed. Then cherubism, eye rolled to the heaven appearance. drugs in ACLS, ventricular tachycardia, levels of thyroid cartilage, and anatomy question, antidote of morphine, Valerian degeneration. So I hope by seeing all these things, you will be recollecting, yes, all these questions were there, right? So we'll be having a detailed discussion very soon. Then gas gangrene is caused by a direct question. Then catheter in the patient urinary tract infection caused by what fungi? So if a catheter is UTI is there, catheter is given, a fungal infection is there. So which is that fungi which will create that problem? Then there was a question on National Pathfinder Survey, different types of amyloblastoma, angle fracture treatment, which we have just discussed, costochondral graft of a child, 8-year child. So what happens is in the costochondral graft, it may regrow, right? Or it may enlarge. Stellate granuloma questions. Retention after orthodontic movement. Then we have got ductility test, dentigenesis, HIV prophylaxis. This is more of an embryology based question mixed up. Then relaxed muscles in maxillofacial surgery, implants, biopsy, asthma during extraction. The patient is having asthma, so during extraction, what will be done? Then most ethical study for the bone growth, tumor showing resistant to radiations, prenatal period and human embryological period, and most fluoride releasing agent. So these are some 50 to 55 questions, 50 here, and oral surgery, we have discussed some 10, 15 questions. So 50 to 60 questions, this we are just going right now. So basically, the overall paper was not too tough, not too easy also. It was a moderate level paper. So any student who has worked throughout the year, who has worked very hard, little bit in depth he has gone. So those students will be in a very comfortable position right now. So very soon we'll be having a detailed discussion by our expert faculties, right? So dear students, if you get a seat, great. If you don't get a seat, don't get disheartened. You will have to keep trying. You have to keep trying till you get a seat, because one should never quit in life. So that is what my message to you is, to wait for the key to come, then wait for your ranks to come, participate in the counseling process. You never know what happens, right? Never give up. Always be optimist and keep trying. If you get a seat of your choice of your college, great. If not, then take a decision what you need to do. And if you want to compromise and go for a seat, a different branch seat, please remember that it's just like marrying a person whom you don't like. So you throughout life you'll have to be with that person. Same way, you should love the branch what you're getting in. If you feel this is not the branch you should go in, think, take advices from all your elders, seniors, professors, everything, and then take a decision. And if you want to restart, if at all it is not gone well, then immediately start without wasting time in procrastination and wasting time, right? So Edentu platform is always there to help all of you. So this is just an overall analysis. The detailed analysis will follow soon. Thank you.